Having worked for Intermountain for more than 20 years, as both an administrator and a physician, I've learned that a healthcare profession is much more than a job. It's more than a career. It's a calling or vocation in the highest sense of those words. It involves not only the rigorous education required to become a physician, but also continual training, growth, and sacrifice. It means keeping up with always evolving technology and science. And it entails a lifetime of service to others. It's a journey that can bring joy, too. That's why we got into this profession in the first place. More than 1,400 physicians and advanced practice clinicians make up the Intermountain Medical Group. Our goal is to work together in care teams to coordinate preventive care and wellness services and manage treatment plans to help people throughout Utah live the healthiest lives possible. That's our mission. In the face of things like administrative duties, patient caseloads, and IT upgrades that require long hours and resilience, I understand feelings of frustration, especially when we're trying to focus on the patient and in providing the highest quality of care. But I also hear regularly from our physicians about the rewards of practicing in our medical group. To learn from our colleagues about their thoughts on the joys and satisfaction of caring for patients at Intermountain, we went around to various clinics and asked them.
We've gotten patients more involved in healthcare. Patients are active participants. They're educated consumers now. We get them involved in the decision-making processes and they participate.
Patients hopefully feel more empowered by their physician to help in the decision-making process. I think it helps in the healing of that patient to have that interaction.
Pretty much in every specialty there's been amazing advances since I've been practicing. Incredible advances in new research coming out. Pharmacy industry, cardiology, in every specialty really.
There's always something to learn, and I think that's, my professors in medical school and teachers in residency really hit every day you should be learning something new. And that's the fantastic thing about medicine is that you really do learn something new every single day.
Preventive care, I think that making sure that we're monitoring the chronic conditions so that people can live as healthfully as possible.
In a perfect world, we could go from patient to patient, room to room, and just see the patient and talk and think the paperwork would take care of itself. In reality, we're asked to document things for a lot of reasons, for insurance reasons, for coding reasons, for law reasons, to help partners. We want to meet those quality measures. We want to excel and be the best.
Keeping up with the latest regulations from the government, Intermountain's done an excellent job with that. They keep us informed. We get emails, memos, meetings that we have every month. Colleagues, having such a big group of colleagues helps too, because everybody's always going to meetings and they come back and share what's been told, what's happening. So we kind of have a big connection that way as well.
I feel like I have a lot of support from my clinic manager and administration, internet help. And it's a benefit of having a huge organization working with you and behind you.
I appreciate working in Intermountain, where I really do feel part of something that's bigger than myself. I think that's one of the benefits to Intermountain Medical Group, is that really we're all partners.
Great thing about Intermountain is that we have high-quality colleagues that can help us through this process. It's their experience, their knowledge that makes it easier for me. I don't have to go through it myself. I can get the information from someone else who's already done it.
I really trust our leaders. They're friends of mine. I feel like they're my friends. And so I'm really happy with how compensation works. I think it's fair. There are changes coming. I do see the future where we're not going to be on fee-for-service. I think that's going to be really good for the patients. It's going to be challenging for us physicians who have been paid in a manner for years to kind of change our way of thinking.
Being able to empower somebody to take care of their body, prevent any future maladies, help their child get through a terrible asthma attack. Those are the day-to-day things that keep me going.
And that's what life's about. That's what I think medicine's about, is making those connections and having people healthy so that they can enjoy the life that they want to live.
There's nothing like caring for people and, more importantly, seeing people get better.
There's always an interesting story every day from patients. It's a really good challenge to have every day when you walk into the office. You never know what you're going to see.
There's such great people, other physicians in the medical group. I feel like they're really the leaders of the medical community in our town.
I was attending a lecture from Muhammad Yunus, who won the Nobel Peace Prize, and he said that if you want to change the world, you need to change your village. And that really resonated with me. My clinic is my village, and hopefully by doing that, I can help change the world of medicine.
Intermountain is that difference between being financially driven to the bottom line is always going to be patient care, safety, and making sure that we have good results.
So even though we face challenges with things we don't understand, or as technology changes, as information changes, hopefully we can work together and overcome those boundaries and those changes.
The population health model, helping us look at the whole person. And as you look at patients, you look at families, you look at groups, communities, and ultimately the whole population, if we can help everybody get healthier, everybody wins.
Going forward, Intermountain continues to focus on patient-centered care and on the whole patient, and I think that's really important.
The direction that Intermountain takes is one that honestly is looking to do what is best for the patient, and not just the individual patient, but the community in which we serve. That saying helping people live the healthiest lives possible isn't just a tagline, it really is a motivation. It really is what we're striving to do.
As you can see, there is joy in the practice of medicine. Clinicians remain committed to caring for our patients and helping them live the healthiest lives possible.